Hi, Stuart and Corinne Kane here from Sydney in Australia. Just letting you know how the first day of closing in the J&J Depai ASR trial went today. It was a very interesting and harrowing day. As a pointer for all of you out there, we learnt today that Johnson & Johnson have spent approximately $17 million to this point defending in this trial. I'll leave it up to you. I would have thought that $17 million could very well have been spent on patients and looking for a treatment for all those of us affected by metallosis cobalt toxicity. So their defence today began very much with surgeons in the gun. Surgeons were blamed for having poor technique, that the ASR had failed at a higher than acceptable rate because surgeons were using poor technique in putting them in. All those doctors out there that have been supporting this company and defending the actions of this company, I'd be very interested to see your opinions of that now, because they blamed you today for the failure of this hip. And I encourage all of you to let your surgeons know that. Another thing that they stated today was that when they did notice that there was a slightly elevated failure risk early in the piece, in their words, they offered training for surgeons that were obviously not putting them in correctly. One surgeon attended this training, but what they didn't mention is that they continued to sell the devices to surgeons that had not been trained. Profits over patient safety. I don't think I need to say any more about that. The next thing that they did was that they blamed the patients. This had my wife in tears, having to listen to this company say that it was the patient's fault that the ASR failed, because when they designed the device, it was designed for specific types of patients. Now, I don't know about you, I was told that the device was the best, the Rolls-Royce of implants, that would last me for 15 to 20 years, and no mention was made to me that I had to be in a specific patient group. And the many thousands of you that I have talked to all vary from all walks of life. Another thing that upset my wife during this was that the way that they talked about patients, they called us statistics. And I hate being referred to as a statistic because I'm a human being. The one thing that all of you Smith and Nephew Birmingham patients out there will love is that they continually compared the failure rate of the ASR here in Australia to the success rate of the Birmingham hip. They are obviously oblivious to the fact that the Birmingham has been recalled in the last week or so, but they did keep referring to it as the gold standard of metal-on-metal technology. They're obviously also oblivious to the fact that nearly every other metal-on-metal device has been removed from the market. One of the things again that they mentioned about these hips was their lifespan. The company stated that they didn't believe or know what the lifespan would be beyond 5 years. As I mentioned earlier, I was told mine would last 15 to 20 years, and I've heard from plenty of other people that they got a similar story. Again, Depai, what's going on there? You're claiming in court that you didn't know what would happen beyond 5 years, and yet they were failing at a higher than acceptable rate. Two other things that they mentioned today. One is the recall effect. Now, I put it to you, if your car, or you're told that your car has a faulty airbag in it that may cause you harm, would you take the car straight back and get it repaired so that no one, you or your loved ones, didn't get hurt? I think so. They expected their patients, that when the recall notice came out, to accept that yes, it might have been recalled, you leave that ASR in there. But no, their argument was that we all rushed out because of the media storm that erupted around this, which I recall as 2 current affair reports, the Four Corners program, and probably half a dozen newspaper articles. However, this media storm made all of us ASR patients rush out, demand that our surgeons remove our prosthesis, and that our surgeons did not look at anything clinical, and they just did that. Well, the other thing they mentioned too was that the company made sure that everyone that had an ASR was notified by their doctor. I found out by my own steam. I actually went and asked my doctor if I had one. Everyone I met in court today found out the same way. And I'd be very interested to hear if any of you out there actually got a letter telling you you had an ASR. I doubt it, because I've yet to meet any person that did. The final thing that they talked about today, other than the recall effect that caused us all to rush out and have our hips removed, was their recall notice. They put it up on the projector to show us that they had ticked a box that stated device recalled due to the risk of patient harm. Their excuse for ticking that box, because our defence had made such a big issue of it, was that they didn't have any other box to tick. Now this form had two other boxes, and one of them said that there was no problem, i.e. no action to be taken, and the third box, from memory, and I'll be happy to be proven wrong, was something along the lines of low level risk. But they chose to tick the one that said device recalled due to the risk of patient harm, and yet their excuse was that they needed to tick a box. Finally guys, in Australia I met some people today that were offered $90,000 in settlement not to attend court, not to be a part of the class action. They have settled with other patients, yet they've spent $17 million defending this case. I very much look forward to hearing what they've got to say tomorrow, because tomorrow they're going to talk about the device itself. To all of you out there, thank you very much for your kind wishes and support. It's been amazing, the messages and thoughts and prayers that we're getting from people. Corinne and I thank all of you for that. I look forward to giving you an update tomorrow, and look, all I can say is that if any company is going to use these tactics to defend a device that's obviously harmful, I can't see how they can win. However, it's up to the court to decide. Thank you very much for listening. Please share this with as many people as you can. It might save me answering a few hundred messages, and we'll look forward to talking to you tomorrow. Cheers guys.